Okay, so I'm going to show you guys everything that happened when Divinity went to the hospital on Sunday. So you can see here that they are scanning her abdomen to look for any dilated loops of bowel that would indicate that she is possibly obstructed. And thankfully they did not find anything like that. And here you can see baby Trinity getting all the lovin's. Everybody loved her. So they're going to apply some alcohol to the other side so they can ultrasound the other side here. And you can see her scanning the whole area. They scanned her chest as well. Not that she was having any breathing issues, but they typically do that. And plus, this is an intern. She's learning everything. So it's good experience. And then they could also see this, which is Divinity's baby that she's going to have next year. Hopefully, if everything goes well. This was seen by placing the probe underneath her up near the udder, and they could see that the baby is in there and alive and well. You can see some bone structures. You can see it moving. You can see some heartbeats and such. Trinity says she's excited for her little baby sibling next year. And Dr. Sloan and I were trying to figure out the gender of the baby. There you can see its spine right there. And we both agreed that it looks like it's probably a boy. So I'm going to do some videos on fetal sexing and explain all that because that's pretty complicated. But her and I agreed it was probably a colt. And this is Dr. Sloan here. She absolutely loved baby Trinity, and Trinity loved her little rubs and everything. People couldn't keep their hands off of her. And Trinity's just checking on her mama, making sure everything's okay.
You really want to touch the baby?
Yeah.
You cannot keep her.
I don't think I would have to resist right now. Dr. Combs is in her internship too, so
yeah.
She's short on the free time thing.
Yeah.
Yeah.
Lactate, it's 2.3, so that's a little bit higher, but
Yeah,
a lot of
it
times
is.
stress can jump that up just a little. Like 2.3 doesn't scare me right now. We'll just see what the rest of it looks like. We've got a mildly elevated BUN, we've got a mildly low calcium and a mildly low albumin, and so all of that kind of supports that there's some mild bleeding in the gut. And so whether that's sand colic, whether that's an interlit, so a stone in the small colon, could also be a small colon impassion or a colitis. And so the diarrhea panel will check for the colitis. We'll do radiographs to check for a stone or sand, and then from there we'll just give her food and water and recheck blood work to make sure she's not getting dehydrated and really just kind of support her while she heals. The biggest thing is we're not out of the woods right now, but there's a lot of still things that could go wrong, but bringing her in this really early is a big factor, and I feel good about this.
Okay, and here you can see they're going to give her some sedation because they have to tube her, of course. Okay, and so here you can see that the doctor does have the tube in her mouth. I know, it's kind of gross, but this is what we do. And she's going to suck on the tube to get the siphon started, and then she's going to attach it to the pump right there, and then that is going to actually force water down the tube into her stomach. So this is one way you can give them fluids if they're dehydrated, but also the purpose of this is to put some water in there to get everything mixed up so that we can see what else comes out to see if she is what's called refluxing. And so we look for reflux to see if they are accumulating fluid in their stomach, because if they are, that can indicate an obstruction. And so we put water in just to kind of mix it up and then pull it back out and see if we get more out than what we put in. And we usually just kind of move the tube around to get it to the right spot in the stomach to where we're pulling it out. So that's what all this is, putting fluid in, pulling it back out, seeing what we get out. So I asked this intern to explain what this is to non-horse people, and here's what she said.
It's basically, so horses and minis, they can't really throw up. So this is kind of like helping them throw up. It's gonna be a tube that'll go to their stomach and like, it'll kind of take out all of their vomit.
And empty out the stomach.
Yeah,
It needs to be
empty out
emptied.
the stomach, yeah. When they're
Because
feeling
otherwise
like
their
that
stomach will
pressure.
rupture.
Yeah.
If they're obstructed.
Mm-hmm. Yeah.
And a lot of times too, we'll get reflux, not because they're obstructed, but they can just have some GI stasis.
Yeah.
So just some slowdown of the gut movement, and so they can reflux a little bit with that.
Or if you have like small intestinal issues, sometimes you'll get a lot of, we usually get a lot of reflux when we have small intestinal problems. Because everything backs up.
And of course, Grandpa had to go see Divinity to say bye. All right, Divinity.
She needs to be cute.
You're a good girl, okay?
So they'll keep me updated on how you're doing. Okay? Everybody say some prayers. Divinity's okay.